Stool stuck in the rectum is more common than most people admit, and it's rarely just about not eating enough fiber. Something deeper is going on inside the body, and today we're breaking down exactly what that is, why it happens, and what actually works to fix it fast. Let's start with what's really happening inside you when stool gets stuck. The rectum is the final stretch before stool leaves the body, and it's designed to do one job: hold stool temporarily, then release it through a coordinated squeeze and relax motion. That motion depends on nerves, muscles, and timing all working together. When any one of those pieces is off, stool doesn't move the way it should. It sits, it hardens, and the longer it sits, the harder it becomes to pass, because the rectum keeps absorbing water from it the whole time it's sitting there. That's the trap. The body isn't trying to hurt you. It's doing exactly what it's built to do, pulling water back into the system, except now that water is being pulled out of stool that should have already left. This is why so many people describe the same frustrating cycle. They feel the urge, they sit down, they push, and nothing happens, or only a small amount comes out while most of it stays behind. That feeling of incomplete emptying isn't random. It's often the first clue that something specific is interfering with the normal release mechanism, and that's where the hidden causes come in, because most people jump straight to blaming diet when the real issue is somewhere else entirely. The first hidden cause is one almost nobody thinks about. The muscles don't relax when they're supposed to. Most people assume constipation is about pushing harder, but pushing isn't actually the main mechanism for emptying the rectum. Relaxing is. There's a muscle called the puborectalis that wraps around the rectum like a sling, and in order for stool to pass, that muscle has to loosen at the exact same moment the abdominal muscles are pushing. If that timing gets disrupted, if the muscle tightens instead of releasing, stool physically cannot move forward, no matter how much pressure is applied. This is sometimes called dyssynergic defecation, and it can happen from years of straining, from chronic stress, from sitting in the wrong position on the toilet, or even from unconsciously holding back the urge over and over until the body forgets the correct pattern. People with this issue often say the exact same thing. I feel like it's right there, but it just won't come out. That sentence alone is one of the clearest signs that the problem isn't the stool, it's the coordination. The second hidden cause is nerve signaling that's gotten quieter over time. The urge to go isn't just a random sensation. It's a nerve signal telling the brain that the rectum is full and ready to empty. But every time that urge gets ignored, whether because of a busy schedule, being in public, or simply not wanting to stop what you're doing, the nerves adjust. They start requiring a bigger amount of stool before they send that signal again. Do this often enough, and the threshold keeps rising. Stool builds up, becomes drier and firmer the longer it waits, and the urge that used to show up daily might now show up every few days, weak and easy to override. This isn't a matter of willpower. It's a physical change in sensitivity, and it's one of the most common reasons people find themselves suddenly dealing with stool that feels stuck when it never used to happen before. The third hidden cause is structural, meaning the shape of the rectum itself has changed in a way that traps stool instead of letting it pass through smoothly. One of the most common examples is something called a rectocele, which happens when the wall between the rectum and the vagina weakens and bulges outward. Instead of stool moving in a straight path toward the exit, it gets pushed into this little pocket, almost like a dead-end pouch. From the outside, it feels exactly like a blockage, because in a very real sense, it is one. No amount of extra fiber fixes this, because the problem isn't dryness or volume, it's geometry. The stool has nowhere efficient to go, so it sits in that pouch while the person pushes, feeling like something is right there but strangely unreachable. This is far more common than people realize, especially after childbirth or years of chronic straining, and it's one of the most overlooked reasons stool gets stuck even when someone is doing everything right with their diet. Now here's something worth pausing on for a second, because it connects to a much bigger discovery that's been making the rounds in gut health circles lately. Researchers looking into why certain populations barely deal with sluggish, stuck digestion at all, even while doing plenty of things that should make it worse, traced part of the answer back to something almost nobody in the US even thinks about, an overlooked underwater ingredient tied to a very different way of supporting the gut's natural rhythm, one that has nothing to do with fiber or water intake. There's a short video that breaks down exactly what this is and why it's getting so much attention right now. If you want to check it out, just point your phone's camera at the QR code on the screen, and you'll also find the link pinned in the comments below. Now back to what else can quietly change the shape of things inside the body. Another structural factor is rectal prolapse, where the tissue of the rectum itself loses some of its support and begins to shift or drop slightly out of its normal position. When that happens, the internal pathway isn't lined up the way it should be, and stool can fold or kink around that misalignment instead of moving straight through. People with this often describe a strange sensation of pressure or fullness that doesn't match how much stool is actually present, because the issue isn't quantity, it's the physical route stool has to travel. Now let's talk about the factor most people expect to hear about, but rarely understand correctly: hydration and fiber. Fiber does matter, but not in the simple way most people think. There are two types, and they behave completely differently inside the digestive tract. Soluble fiber absorbs water and forms a soft, gel-like consistency, which is often the type that actually helps stool move more comfortably. Insoluble fiber adds bulk, but without enough water in the system, that bulk becomes dense and dry instead of soft. And dense, dry stool is exactly what tends to get stuck in the rectum. So loading up on fiber without also increasing water intake can sometimes make the stuck feeling worse, not better, because the fiber pulls in whatever water is available. And if there isn't enough water available, the stool becomes firmer instead of softer. Certain medications also play a bigger role than most people expect. Painkillers in the opioid family are well known for slowing down the entire digestive tract, but other common medications, including some antidepressants, iron supplements, and even certain allergy medications, can quietly reduce the natural muscle contractions that move stool along. When those contractions slow down, stool spends more time sitting in the colon and rectum, which means more time for water to be pulled out of it, which means firmer, harder to pass stool by the time it reaches the exit point. Posture on the toilet is another surprisingly powerful factor. The traditional seated position, with the hips bent at roughly 90 degrees, doesn't actually align the rectum in its most open position. Raising the knees above hip level, similar to a slight squatting position, straightens out the natural angle of the rectum and reduces the amount of effort needed to release stool. This single adjustment, something as simple as putting the feet on a small stool while sitting on the toilet, has helped many people reduce straining almost immediately because it works with the body's natural anatomy instead of against it. So what actually helps fix this quickly and safely once stool is already stuck? The first step is never aggressive straining, because forceful pushing against a rectum that isn't relaxed can worsen muscle coordination problems and even contribute to structural issues like the ones already described. Instead, gentle abdominal massage in a clockwise direction, following the natural path of the colon, can help stimulate movement without added strain. Warm fluids, especially in the morning, can help trigger the natural reflex that signals the colon to become active. Adjusting posture with the knees raised can immediately reduce the mechanical effort needed to pass stool. And in cases where stool has become very hard and is genuinely stuck, a glycerin suppository or a small enema can help soften and lubricate the stool directly at the site where it's stuck, offering relief in a way that oral fiber alone often can't, especially in the short term. But the most important long-term fix is retraining the body's natural signals. That means responding to the urge to go as soon as it appears, rather than delaying it, and giving the body consistent opportunities, ideally around the same time each day, to reestablish a reliable rhythm. Over time, this consistency helps restore the nerve sensitivity and muscle coordination that may have been thrown off in the first place, addressing the root cause rather than just managing the symptom. Understanding why stool gets stuck changes the entire approach to fixing it. It's rarely about willpower, and it's rarely about one single cause. It's usually a combination of muscle timing, nerve S, sensitivity, structural changes, and everyday habits that quietly stack on top of one another until the system stops working the way it's supposed to. Once you understand which piece is involved, the fix stops being a guessing game. Let's go deeper into some of the everyday habits that make this worse, because a lot of people are unknowingly reinforcing the exact problem they're trying to solve. One of the biggest is delaying the urge to go because of timing or convenience. This happens constantly with people who have busy mornings, long commutes, or jobs where stepping away isn't easy. Every time the urge is pushed aside, the rectum stretches slightly to accommodate the stool that's waiting, and a stretched rectum requires a larger volume of stool before it signals the urge again. Over weeks and months, this can retrain the body to need more and more buildup before sending that signal, which naturally leads to firmer stool sitting for longer periods before it's ever addressed. Another overlooked habit is chronic straining itself, even in small amounts. Many people strain lightly almost every time they use the bathroom without realizing it, treating it as a normal part of the process. But repeated straining places ongoing pressure on the pelvic floor muscles, which can weaken their support over time and contribute to structural issues down the line, including the rectocele and prolapse concerns mentioned earlier. It becomes a slow cycle. Straining leads to weakening, weakening leads to less efficient emptying, and less efficient emptying leads to more straining the next time. Dehydration is another quiet contributor that often gets underestimated. Many people don't drink nearly enough water throughout the day, and when the body is even mildly dehydrated, it prioritizes water for essential functions first, pulling extra water from wherever it can, including the digestive tract. This means stool sitting in the colon and rectum loses moisture faster, becoming harder and more difficult to pass, especially when combined with any of the other factors already mentioned. Stress deserves its own mention here too, because the gut and the nervous system are deeply connected. When the body is under chronic stress, it often shifts into a state that prioritizes alertness over digestion, which can slow down the muscle contractions responsible for moving stool along. This is part of why some people notice their digestion changes noticeably during particularly stressful periods of life, even when their diet hasn't changed at all. Now, it's worth addressing a distinction that often gets confused: the difference between occasional stuck stool and a pattern that keeps repeating. An occasional episode, especially after travel, a diet change, or a stressful stretch, is common and usually resolves with simple adjustments like the ones already covered. But a repeating pattern, especially one involving straining, incomplete emptying, or needing manual assistance to pass stool, points toward one of the structural or coordination-based causes discussed earlier, and those often benefit from more targeted approaches rather than general lifestyle tweaks alone. One approach that's proven particularly effective for coordination-based issues, especially dyssynergic defecation, is biofeedback therapy. This involves using sensors to help a person visually see when their pelvic floor muscles are contracting versus relaxing, essentially retraining the brain to recognize and correct the exact miscoordination causing the problem. Because the issue is often about timing rather than strength, this kind of retraining can be remarkably effective, helping people relearn a coordination pattern that may have gradually drifted off course over months or years. For structural causes like rectocele or mild prolapse, treatment often starts conservatively, focusing on softening stool, improving posture, and reducing straining, since many mild cases improve significantly without needing anything more invasive. More significant structural issues may require additional evaluation, but even in those cases, the starting point is almost always the same: reduce the pressure and strain placed on the area and support the body's natural rhythm rather than fighting against it. It's also worth mentioning that fiber and hydration still matter here, just with more precision than most people realize. The goal isn't simply more fiber, it's the right balance of soluble fiber paired with enough water to let that fiber do its job effectively. Without enough fluid, increasing fiber intake can sometimes tip things in the wrong direction, adding bulk without the softness needed to move it along smoothly. When you put all of these pieces together, a clearer picture starts to form. Stool doesn't get stuck because the body is failing at random. It gets stuck because a specific mechanism, whether that's muscle timing, nerve sensitivity, structural shape, medication effects, hydration, or posture, has been quietly disrupted, often by small habits repeated over a long period of time. And because the cause is specific, the fix works best when it's specific too, rather than relying on generic advice that doesn't address what's actually happening internally. Understanding all of this also means understanding when stuck stool is simply an uncomfortable inconvenience, and when it's signaling something that deserves closer attention. A few patterns are worth paying attention to. If stool is consistently hard, pellet-like, or requires significant effort every single time, that's a sign the underlying mechanism, not just the diet, needs addressing. If there's ever a sensation of something bulging near the vaginal wall during a bowel movement that lines up with the rectocele pattern described earlier, and it's worth having evaluated rather than managed indefinitely on your own. If relief only comes with manual assistance, meaning physically applying pressure to help stool pass, that's often a clearer sign of a structural or coordination issue rather than a simple fiber or hydration gap. And if there's ever blood, unexplained weight loss, or a sudden change in bowel patterns that wasn't there before, those are signs to have things checked rather than assumed, simply because the body is communicating that something beyond routine constipation may be involved. None of this is meant to cause alarm. In most cases, stuck stool comes down to the everyday mechanisms already covered: timing, posture, hydration, muscle coordination, or a structural shift that's often manageable with the right adjustments. But knowing the warning signs means you're never guessing blindly, and you know exactly when a situation calls for a closer look rather than another home remedy. It's also worth remembering that the body's signals are consistent once they're restored. Many people who struggle with this for months or even years are surprised at how quickly things improve once the actual mechanism is addressed instead of the surface symptom. Someone dealing with dyssynergic defecation might spend years assuming they simply need more fiber, when the real fix was learning to relax rather than push. Someone with a mild rectocele might spend years blaming their diet, when adjusting posture and reducing strain resolves most of the day-to-day discomfort. And someone with a rising urge threshold might be surprised at how quickly the body recalibrates once the urge is respected consistently instead of postponed. That's really the core idea behind all of this. Stool doesn't get stuck because the body is broken. It gets stuck because a specific signal, muscle, or structure isn't working in sync with the rest of the system, usually because of small patterns repeated over time. Once that piece is identified, the fix is rarely about trying harder. It's about working with the body's natural design instead of against it, whether that means adjusting posture, responding to signals sooner, balancing fiber with enough water, or giving overworked muscles the chance to relearn their natural rhythm. Understanding your own body this way changes the entire relationship you have with something as simple and as universally experienced as a bowel movement. It stops being confusing or frustrating and starts being something you can actually read, understand, and respond to, because now you know exactly what's happening beneath the surface and exactly what that discomfort is trying to tell you.